Hi everyone, this is Buzz again. Now I did my inaugural video already and I spoke a little bit about mental health in America. I want to kind of entitle my general time online is here's what I got so far. And why I say here's what I got so far is because I think there's so much more that you can get in life if you want to learn. We're never going to stop being students. We'll always be a student. But I want to talk to you a little bit about mental health today because I spent so much of my life in it. I spent 23 years, over 5,000 patients. I was a consultant for a social service agency. I've done seminars. I did a lot of work. I was a clinical director and I was a clinical supervisor. So I did all the legal stuff. I ran an agency before. I've been through all that. And I retired 10 years ago. And to be frank with you, I thought I was done. But here I am 10 years later, and I'm coming to you, perhaps to help you, and I hope that I will. I want to talk to you a little to people who maybe have never gotten mental health work before. Let's say you're stressed and you don't know if you have a mental health problem. Maybe you're feeling down, and again, you don't know if you have a problem. The typical process goes like this. You normally would call a mental health agency. Usually these would be outpatient, is what I would suggest you do. Don't show up at a mental health hospital unless you're suicidal or something like that. But if you're just stressed out or you're depressed and you're not sure if you have a clinical problem or not, you want to show up and get evaluated. That's usually what they do. They'll set you up with an evaluation. After the evaluation, they'll determine whether you have a mental health disorder. And they'll also determine in the process your ability to function, because that determines not only does the disorder determine the level of care, but your ability to function in the world, your social world and your work world, school, or what have you. This determines the level of care that you might get. As a therapist, typically after I diagnose you, if you have insurance, then I'm required to send to your insurance company a summary, diagnosis, and a treatment plan. And then they'll determine whether they want to pay. Now, normally before the evaluation, an intake worker will call your insurance company. So 99 out of 100 times that intake is covered already. But for me to get additional sessions, I would need to get approval from your insurance company. So what else happens? Well, what happens is if you're in an agency, obviously there's a record of what you and I talked about. And the other thing I think you might want to know about going to an agency is most people go to agencies near where they live. That only makes sense. The problem is you might meet your neighbor there. And that may not be so, some people may not like that. You know, you certainly don't want you to know your neighbors that you're in a mental health place trying to get mental health help. So I'll get back to that and why that's important. The other thing is that when the insurance company gets your information, they also have what's called a medical information bureau, which on that bureau will say John Doe, and they'll say clinical depression. And it's there. Now, who might use that? Well, let's say you want to get life insurance. They possibly could get hold of some of those records. I think the big thing is people say, well, you know, it's confidential. Well, yeah, if you don't meet anybody there, you know it's confidential. And obviously, if somebody's working there and knows you, you have a record there, a written record of whatever it is that you talk to your therapist about. Also, you have the Medical Information Bureau. So as much as I know that everything is going to be confidential between you and your therapist, because we sign these confidentiality agreements with you, I wouldn't think that confidentiality could be absolutely guaranteed. The other thing I would talk about is length of care. And normally, they'll give you 4 or 6 sessions. And then after that, we have to go back again to get approval for any additional sessions. And that requires a lot more depth of what we talked about and the need for getting additional care. Also, if you need a higher level of care, we have to go and apply for that in advance. We can't automatically send you somewhere unless, of course, you're in crisis, and that's a different situation. So that gives you a basic idea of how the process of getting mental health works. Many of you, maybe you're not sure. Maybe you don't want to go through the process to find out whether you have a problem or not. Here's the issue that I see in going there. As a therapist, if you come in and you've got your insurance, I'm not going to get paid and I'm not going to get lessons unless I find a diagnosis. So maybe people are close to being clinically depressed, but they're more likely to call it clinical depression and say to you, well, you don't quite qualify for insurance, and maybe we'll just see you on a cash basis. We'll call it cash basis. That can be quite expensive. Normally in America, an evaluation, if you're going to pay cash, is about $140 on average, and a session would probably be about $85. Even today, when you go online, and there are people that offer some services online, if they're going to go through your insurance, it's still going to be, cash basis will be about the same, but the insurance, you'll have to do the same things. And insurance will be a lot more skeptical about online counseling because it's just more difficult to really pull records where they could be easily seen. When I was clinical director, the state that I worked in used to come in and check our records. It could actually get physical copies So it was a lot easier for them to manage our care, okay? Let me offer you an alternative, okay? They said, I've got a lot of history and experience in working with mental health. I was very well known in my state to work with adolescents. I can tell you, was that something I wanted to do? Absolutely not. Was I wanting to say I want to be an adolescent counselor? Absolutely not. It found me. Through the process of, as a male therapist, I ended up starting out in the adolescent prisons, doing life skills work, doing general therapy work. And then I started working around all the probation departments. I got well known to do that kind of work. But I also dealt with a lot of other people. So I will tell you, if you're interested in doing some counseling with me directly online, there's a couple people that I don't do with. I don't work with any children under the age of 12. You know, it's very difficult. First of all, I think it's difficult to do that online, but I just don't have any background and experience. I'm usually from 12 and up. I don't deal with any people with eating disorders. I've tried to do that in the past, and I found the problems are often quite deep-seated, and it's very difficult, for at least for me, to deal with that population. I also don't deal with anybody with thought disorders, for example, or schizophrenics, or people of that nature. The reason being is the majority of them are getting most of their help organically through the use of medications provided by a psychiatrist. So I don't think that talk therapy is probably the best way for them to get help. Although anything additional would help, I just don't feel, I feel restricted in being able to do that online. Anything else I could certainly help you with. Here's the biggest thing that I offer. Because I'm retired, okay, and I don't have to work under the auspices of insurance companies or any state boards or anything like that, I can offer this very reasonably cost. And there's not really any human problem that I haven't dealt with during my history. I know that I can help you. And the other thing I can help you with is some of you who don't want to go through the process, or some of you who have gone through the process and you can't get sessions anymore. It's going to cost you a lot of money to get sessions if you go one by one in a lot of these agencies. They're probably going to charge you $85 for every time you go in there. You can do it at a vastly reduced price. You can contact me on I have a email address that'll be attached to this video. You can certainly question me, my availability. I can work either on a 30-minute level, or I should say 25 minutes, and a 50-minute level. So if you want to give 25 minutes with me, you can do that. If you want to have 50 minutes, of course, the prices will be more for the 50-minute. I guess you can expect that. And I'll do what I can to help you. But I think the thing is I don't send your information anywhere else. Anything you say to me stays with me. It doesn't go up on the wall somewhere where other people that may know you might look at your information. You're not going to see anybody online with me that know you. So I can guarantee you a much higher level of confidentiality. I'm also very secure in the way I set up my counseling online to protect you from any outside influence that may try to break in for whatever reason. If you have any questions, maybe you have questions about it, whether you have questions about therapy itself, whether you have questions about mental health, whether you have questions about whether or not I can help you, or you have questions about price and availability, contact me. I'd be glad to answer all your questions. That's what I'm here for. Yes, I am retired. I have limits in how much I can do. So the sooner, if you really want some help from me, the sooner you contact me, the better, because I'll get busy quite quickly. That's it for now. We'll talk to you next time about maybe a little bit brighter subject, okay? And we hope you have a good day. Take care. We'll see you.